Okay, so welcome everybody. I'm sure there are still people that we will be getting, but I think we're on time, so we probably need to start. So I'm just going to load. It's now, just to say, it's not allowing me to load a presentation, by the way. Okay. GDN team, WWS. When I press on the monitor thing, it's not allowing me to select something.
Okay, you're facing the issue of sharing. Just give us 1 second. We'll just resolve. We'll resolve. Thank you.
We still don't have many people yet in the room, so. Yeah, it's not allowing me to share.
Ian, if the one option could be for you to share all the slides with me and I can share them until you get access, because I'm able to share.
Yeah, IT team is here. He'll help you.
Hello.
Sir, our chair is not able to share his screen. Somehow it's not working now.
Just there, let me show you the option so that it will be clear for you.
He able to do it earlier, but unfortunately not now.
Oh. There is a button of share. So is there any message or it's not highlighting the monitor button?
No, it's showing, but when I click on it, nothing happens.
Oh, it's a strange. In which browser are you using? Is it Chrome?
Firefox.
Actually, we recommend all the speakers to use Chrome because that is very user-friendly. So I would suggest you to use if it's available for you.
It's not available, and that's not acceptable that you allow us only to use Chrome, I'm afraid. It was working perfectly a few minutes ago. Anyway, Archie, I've sent you Kwaku's presentation. I'm just going to send... but it was working a minute ago. That's what I don't understand.
It worked during the tests also, right? And yesterday when you presented, so it's not a question of the browser at all, Azhar. I don't know. Let me also try. It seems to be working for me right now if I wanted to share something.
Ramona, just few minutes back also it was working. All of a sudden it just stopped. That's the problem.
Okay, so meanwhile, I'm just going to try and send my presentation to Archie. Archie, it's the one that starts WWGS, but I can start on.
You sent it. Yeah, you sent it by a little while ago. So I have this.
There we go. Great. Okay, so welcome everybody. Sorry for that glitch. I think we're all getting to check out the technology. So here we have a session with 3 rather different presentations, but the theme is around knowledge brokering in Africa. And so I'm going to try and weave a little bit of a thread here. But first of all, I just want to introduce the people that are going to be here. So next slide, Archie. So first of all, me, just to say I'm an advisor on evaluation and evidence systems with Clear Anglophone Africa. And I used to work in the South African government where I led the evaluation system and recently published a book on using evidence in policy and practice, and in that we also looked at knowledge brokering. Next slide. So Kwaku Appiah-Kubi is Ghanaian. He's a senior lecturer in the Department of Applied Biology at a university in northern Ghana with a PhD in clinical laboratory diagnostic medicine, and he's leading staff at public universities in northern Ghana to create this West African Center for Evidence-Based Health Research and Transformation, and looking to establish an African network, a similar African network. Next one. Then Archi Rastogi is the evaluation advisor at interim at the Green Climate Fund. And he began his career at a grassroots nonprofit, worked in a diversity of sectors. He's also an adjunct senior research fellow at the National University of Singapore with a PhD in natural resource sciences. And lastly, we have Andile Madonsela, who works at the Africa Center for Evidence on evidence synthesis for evidence-informed decision-making. She's working on systematic reviews, evidence maps, and rapid reviews, been involved in community work, and is currently studying her master's degree. So with that, I just want to show a couple of slides just to give us a little bit of a feeling of around knowledge brokering. And apologies for those of you who were at the session yesterday, but I think we need some sort of framework because we've got three very diverse presentations. So just when we think about knowledge brokering, we need to think about the supply side, making evaluation and research evidence and other evidence accessible, making sure the knowledge is relevant, making sure it's credible and timely. And we also need a demand side. We need there to be demand for evidence and learning in the executive, or if you're a nonprofit, in your management or board. You also need the capability to use evidence. You need the supportive and sustainable structures which support evidence use. And hopefully there'll also be demand from the wider public, from think tanks, from Parliament. And to make all this work, the glue that makes all this work, there's an evidence brokering role. And many of us, I think, in this panel are working in some ways in this role. And it's to try and unpack something about this role that I hope we'll manage to discuss more about today. Next slide. And in terms of knowledge broker roles, I presented yesterday that it's three sort of core roles. One, which is being a facilitator and linkage agent, managing the context and facilitation of networks, relationships, the process of the evidence journey, stimulating interaction, trust, and commitment. There's a knowledge management role, which we're more familiar with, the development, transfer, and translation of knowledge. And there's a developing capacity role, developing both institutional and individual capacity to produce and use policy relevant knowledge. So that's just a bit of a framework for us to look at to consider the three presentations we're going to have now. And with that, I'd like to ask Kwaku to present, and Archie, I think, is going to be handling the screen to present his presentation. Just invite people, of course, to put questions in the Q&A or in the chat, and we will take those later. So just waiting for the presentation to be shared. There we go. Kwaku, over to you.
Thank you very much, Mr. Chairman. Good morning. I am here to make a presentation on establishing West Africa Center for Evidence-Based Health Research and Transformation, a vital force for research and education in higher education institutions for contextual evidence synthesis on non-communicable diseases healthcare in Africa. My name is Kwaku Appiah-Kubi. The outline of my presentation is as follows. There will be an introduction and an overview of systematic reviews and meta-analysis of 6 non-communicable diseases in 4 West African countries. And then we will also look at developing stronger higher education institutions in Africa for evidence-based research and education, thus establishing the WACEBHRT. Then I will conclude. Non-communicable diseases versus infectious diseases. This is what we will be talking about the bulk of our time. You will all agree with me that non-communicable diseases is now becoming a global public health concern. Evidence has shown that over the past 3 decades, world infectious diseases is decreasing from 42 to 17%. Non-communicable diseases is on the increase from 47 to 69%. So what do we do about this? Should we continue to focus attention on infectious diseases or non-communicable diseases? I think that a focus on non-communicable diseases, as far as evidence synthesis is concerned, might do us a lot of good. Why? Because it is still possible to look into how infectious diseases are associated with non-communicable diseases. So clearly it will not be only or solely non-communicable diseases. How do we to effectively do this? We can employ evidence-based clinical investigations and also contextual evidence synthesis, health research and education in Africa to champion this cause. This is because there is clear evidence now that comparing the North or developed countries to developing countries, non-communicable diseases is on the high in developing countries than developed countries. This talk, in summary, will give us, we will be using the PubMed database to do a situational analysis of systematic reviews meta-analysis as a tool for evidence synthesis of 6 non-NCDs in 4 West African countries and strategies that could be put in place to improve on NCD healthcare in Africa. Next. Yes. What we have here is a systematic review and meta-analysis of 6 NCD in 4 West African countries. The 4 West African countries are Burkina Faso, Ivory Coast. These are French-speaking West African countries. And then Ghana, Nigeria are also English-speaking West African countries. What we did was to do a search on PubMed database. And what you can see here is the result. To do the grouping, we looked at total only systematic reviews and total of systematic reviews and meta-analysis. SRM here is only MA, only meta-analysis, and only systematic reviews and meta-analysis, separated from only systematic reviews. As you can see, for total of only SR and SRMA, Nigeria has the highest number of about 115 reviews, followed by Ghana, 62, Burkina Faso, third with 7, and Ivory Coast has the least number of only 3. We also try to do some exclusion. Where a study is updated, we still consider it as just one study. And where an erratum is published, that is also excluded. Then we looked at the total number of research that we excluded. So for Burkina Faso, 2 was excluded. For Ghana, up to a total of that, and that was excluded. Then Nigeria, you can see exclusion as well. Then we also try to look into collaboration, whether research was done collaboratively or just within the country. So here, out of about 7, just 2 was done within. This, to look into collaboration, the author affiliation was considered. So for example, if you take Ghana, where the author affiliation is only made of Ghanaians or Ghanaian institutions, then we assume that that was done only in Ghana. Then where there is collaboration, you might see other countries within Africa and also out of Africa or from the north. Majority were USA and Netherlands, Canada. These are some of and UK as well. Now to look into the distribution of the 6 diseases that were studied. The 6 diseases that we looked at are cancer, cardiovascular diseases, hypertension, diabetes, chronic kidney disease, and also sickle cell disease. Looking at this critically, you can see that cancer, and yellow here is Nigeria. Nigeria has a lot of studies in cancer, followed by Ghana, and we also have Ivory Coast doing something, and Burkina Faso didn't do anything at all on cancer. Just one study on cancer. Ivory Coast didn't do anything at all on cancer. Then cardiovascular disease, again, Nigeria is leading, followed by Ghana. Then we have something to show for Burkina Faso this time round. And so in that order, overall, if you take a careful look at this graphical presentation, you would observe that in virtually all the 6 diseases, Nigeria has done relatively more, followed by Ghana. Then we also have Burkina Faso, and lastly, Ivory Coast. This is the situation on the ground. As far as publishing systematic reviews and meta-analysis of these 6 non-communicable diseases in West Africa is concerned. Next slide.
Kwaku, you only have 2 minutes left.
Yes, now to assess collaboration, this is what you will see. The bulk of the research was done via collaboration. The last slide, bulk of the research was done via collaboration, as you can see in blue. Then for years, bulk of the research was done in the last 2 decades. The bulk of the research was done in the last 10 decades. Next slide, please. Next slide. What strategy must we put in place to ensure that this situation is worked on? As you can see, the numbers is not that encouraging as far as systematic reviews is concerned. So we looked at this and felt that there is a need for us to establish a West African Center for Evidence-Based Synthesis to facilitate and also improve upon the systematic reviews in our part of the continent. Yes, with this, we are sure that we could even extend it to the remaining 4 sub-regions of Africa to increase or improve upon collaboration. To do this, we are also looking at or considering establishing an evidence-based health research network in Africa as a ground for collaboration with higher education institutions in Africa and sub-regional centers for evidence-based health research and transformation. Next Prof. In conclusion, establishing a West African evidence-based health research and transformation for research and education is crucial for intensive evidence-based clinical research and contextual evidence synthesis in Africa. To be honest with you, there is a lot. Let's take a careful look at COVID, for instance. The evidence is showing that we have a lot of medicinal plants in Africa, that will do a lot of work, not only for Africa, but the global community. With evidence synthesis, we could look into or research to come up with some of the evidence that is needed for not only for Africa, but for the entire globe. To do this, there is a need for us to build capacity. And I can assure you, or I can state that as we speak, we have 3 universities in northern Ghana: CK Tedam University, SDD Dombo, and the University for Development Studies. These 2 universities were created from the University for Development, 2 campuses of University for Development Studies. What I have done is to start by introducing them to what I call N3HRP. N3 here means 3 universities in northern Ghana. HRP is Health Research Partnership. We also, under the N3HRP, we also have a group, a WhatsApp group made up of about 26 staff who are, or academics who are into health-related research. And I can assure you that we have started building capacity in this area. For sure, we will definitely need this. Create a dynamic team that will lead a sustainable and functional WACEBHRT, and leveraging on international expertise to make this appreciable to the global community. Thank you.
Thanks, Kwaku. So very, very encouraging to see this capacity being established, not even in Accra, but in northern Ghana. This is excellent. Okay, so with that, I'd like to hand over to Archi for a very different sort of presentation around values.
Yes,
you're muted, Archi.
Thank you so much. I'll just take 1 second to arrange myself, to arrange my slides. Just give me 1 second. And there we go. Thank you, colleagues. I think you should be able to see my slides coming up in just a second. There we go. And thank you for the introduction, Ian. Colleagues, my presentation is not directly only related to Africa, but applies to other contexts as well. This is a paper that I'm writing and developing, so I really look forward to it. So your feedback also would be quite useful on this paper as I develop it, and I really appreciate the opportunity. I'm here talking about evaluators as advocates and drawing some perspectives from the social studies of sciences and the similarities, based upon the similarities of evaluation as to sciences in general, and drawing upon the philosophies of sciences as well. Just as a background, we know that the social studies of sciences tell us that environmental decisions are often politically contentious, socially wrenching, and replete with scientific uncertainty. If we read the literature, for instance, from Serwitz, etc., who takes the example of the simple act of counting votes in the American elections of 2000, the Gore versus Bush elections. But Serwitz gives the example of, depending on which side you were on, and depending on which side you took, you found difference. The results became contentious, not because of anything, but because every variable in that process was contested, depending upon the results, whether it was the number of votes or the way the votes were divided or counted or the ballot machines, etc. So when it's something as simple as counting votes can be so complex or so contentious, think about another area as complex as making decisions for the planet, and these can get extremely challenging. In this context, I'm asking the questions: should the evaluator be limited to the provision of dispassionate judgment and objective evidence to decision makers, or should the evaluator then become an advocate for the use and uptake of evidence? So with that, let me draw some parallels and some differences between sciences and evaluation. So sciences and evaluations are, of course, very, very similar things. Evaluations are founded in some ways in the discipline of economics, but both of them are essentially ways of generating evidence, systematic ways of looking at evidence and generating hypotheses and testing hypotheses. They both have very similar standards of excellence, transparency, rigor, notions of objectivity. And evaluations, much like sciences, are a collection of different disciplines. All of us come from different disciplinary backgrounds and come to evaluations and enrich the discipline, which also means that evaluations, like sciences, are very rich with diverse kinds of worldviews and disciplinary lenses, which make both of those things very, very complex. Values play a very important role in sciences, but values also make sciences very contentious. What are values, firstly? So values are an important part of the played by character. This is the important part played by the characteristic in the functioning of a process. So for instance, in a museum, temperature and light could be a value, but in a TV set, sharpness could be a value. And these things are then valued by the consumer, by the processor, and accorded some functional aspirational quality. So it's a feature of a human experience, and and sometimes it's difficult to measure, but can be estimated on the basis of the judgment of the individual experiencing it. But what happens is that when decision theory tells us then that when a decision has to be taken, two sets of variables come into play. One is the decision of gains and losses on the one hand, and the other is the probabilities of either outcome happening. And then a lattice is created where decisions could be made. But when you apply this to sciences, it becomes complex because probabilities are disputed and values, gains and losses, are gauged differently by different parties. So this creates the fertile grounds for contentions. It's less relevant for disciplines such as astronomy or paleontology, where gains and losses are largely absent. But it's very relevant for normative disciplines, which have implicit or explicit values, and disciplines such as conservation biology or public health, which my colleague was just speaking about, can involve such decisions where gains and losses and probabilities are both quite relevant. And therefore, this applies as well to evaluations, because evaluations, after all, are systematic ways of generating evidence. Evaluations themselves are value-laden, and this leads to contentions as well. So firstly, like sciences, evaluations also supply contesting parties with their own bodies of relevant and legitimate facts about experiences. And these facts are then chosen because they help make sense of the worldviews already held by the consumers, and they supply us with evidence that conforms with our normative frameworks that we already hold. And as I said, evaluations are also multidisciplinary, like sciences, and many different competing disciplinary lenses can be applied to, can be accommodated in a single evaluation. And therefore, an evaluation can subscribe to many different competing worldviews or normative frameworks at the same time, very often. And one other important point is that evaluations also subsume or assume some amount of uncertainty, and are very often based on certain assumptions, which can then also be contested and can lead to some sort of a sense of coherence among competing scientific understandings. We could take the example of COVID, for instance. When the COVID vaccines were first developed and were ready to be administered, it involved the judgment who gets priority in COVID vaccine, what counts as a priority. And so that decision was very contentious. The WHO provided its own guidance and prioritized certain groups, professional groups as well as age groups. That's one kind of decision that gets difficult to make. In the case of the institution where I work, where billions of dollars worth of investments have to be made on a climate crisis, the decisions on gains and losses get very, very pronounced, and a minor change in the course of the fund can result in gains and losses to many different parties. So therefore, this becomes quite important for us. And this also means that evaluations themselves are subject to scrutiny. Very often, this scrutiny is is well-intended, but can distract from the purpose and utility of evaluations, because then evaluations by their very nature, like evidence, lend themselves very well to controversies and to decision-making. With that, I'm proposing 5 strategies to make evaluations extremely useful to decision makers. Firstly, I'm proposing that as evaluators, we should recognize the value systems right from the beginning. Once we recognize that as evaluators that we operate within the paradigms of a value system, this helps to clarify to the users of these evaluations what the value systems are within which we are operating. Evaluations don't occur in political or social vacuum. So if I am providing to a user a strategy evaluation, they can make their own judgments and make their own inferences and interpretations depending on the value system that I used to do the evaluation. The second recommendation that I'm making, or the second strategy I'm recommending, is to clarify the normative standards within which the evaluation was undertaken. In the last few evaluations I've undertaken, we've clarified this normative framework from the perspective of the object which was being evaluated. So, for instance, in the case of an evaluation of investments in the small island states, we found that urgency, the needs of capacity, and the needs for climate adaptation were key. And these became a running theme throughout the evaluation, and we found these themes on these normative standards had to be promoted by the evaluation. Likewise, for an evaluation of the GCF approach, or an approach to the private sector, we found that vulnerability and catalyzing of the private sector investments were identified as needs. I'm just using those examples, not very important. My point is that once we clarified these normative standards, we were then able to make the case for these standards throughout the evaluation. And then we were able to make that case quite convincingly. Thirdly, I'm proposing that evidence is and this is quite self-explanatory and needs no argument, but evidence should be presented in a clear and transparent manner. And this is no different from, let's say, use of thick descriptions in grounded theory or other ways of removing bias in evidence curation. But if we present the evidence in a very, very rigorous manner, then the consumer is able to draw their own interpretations, and also it contributes to the credibility of evaluations. Fourthly, I'm recommending that evaluators have skin in the game. So we can have buy-in in the process. We can take ownership of findings and recommendations, and be able to defend them and be accountable for the rigor and objectivity that we present. And finally, I'm recommending that we communicate with the users. And we ensure that the evaluation is read and consumed in a way that's appropriate, and then we become advocates for some of that evidence and for the use of that evidence in the decision-making. And this brings us back to the challenge of environmental problems, many of which are actually communication problems. The same object and the same event is seen. I'm taking the example of the COP26 here, and this is a cartoon from a blog that I found, that the same event is seen as a failure from different perspectives. Ultimately, a lot of climate and environmental challenges are those of communication. There's underlying divergence in value systems, and this can't be addressed through evidence alone. And the literature on social science, studies of sciences tells us that no amount of discussion alone will resolve differences in value systems. So as evaluators, if we recognize this and use this in our work, this can be quite useful. But at the end, we also have to have some humility that evidence is only one of the many factors that determine a decision, and decisions are ultimately made taking into account a lot of different paradigms and a lot of different priorities by decision makers. With that, I'll conclude. Thank you so much. My email addresses are on the screen, and I'll be standing by for questions as well. Thank you.
Thanks, Archie. I think people tend to take the view that evidence is self-evidently value-free, and it's not true. And a very helpful reminder, I think, that we need to recognize values and that it needs to be acknowledged as part of the process. With that, I'll hand over to Andile.
Thank you so much, Ian. I'm just trying to share my screen right now. I feel so privileged to have the honor to close off such great presentations. My name is Andile Madonsela, and today I will be presenting the work that myself and Laurenz have been doing around assessing measures of evidence-informed decision-making and implementation. So the aim of this project was to understand what measures are used to assess the impact of initiatives to support evidence-informed decision. And it was based on our understanding that there is a growing recognition and investment towards initiatives that support evidence-informed decision-making. And those initiatives are usually aimed at, for an example, facilitating interactions between decision makers and researchers, or influencing the decision-making structures and processes. So although this growing recognition is good, the issue is that we do not know if these initiatives do in fact contribute towards policies that lead to positive development results, such as reducing inequality and poverty. And this is partly because initiatives do not measure if evidence use has increased. So we therefore followed evidence mapping processes to collate evidence that develops measures which can be used to assess the use of evidence in both policy making and in implementation. We found a healthy body of EIDM measures, most of which are made up of different verifiable indicators. So in collating the evidence base, we searched a number of websites and academic databases using an exhaustive search string. We did not exclude studies on geography, and we also considered all publication types. So we included academic papers, grey literature, opinion pieces, and. But studies which measured intermediate outcomes, such as organizational capacity, were not included. We searched and got over 20,000 hits, but after screening these hits, we had 37 measures from the evidence base. The evidence base that we have ranges between the years 1983 to 2021. And we found the study from 1983 quite interesting, because from that study, we know that even back then, there were already 6 measures which were used to measure evidence-informed decision-making. And it is quite interesting that scholars even back then were concerned with the idea of measuring evidence-informed decision-making. We have 4 publication types, but most of the evidence base is made up of journal articles, and the evidence base has different measures, such as SAGE, letter of research use, SAIL, and many others, which I will show when I move to Prezi soon. So like I said, we found 37 EIDM measures, and these measures are made up of over 400 individual indicators. And we grouped these indicators into 4 categories of indicators which measure the process of evidence use, the context of evidence use, the outcomes of evidence use, and the impact of evidence use. We also have 1 category that has cross-cutting indicators, such as indicators which point to monitoring and evaluation. These categories are further divided into themes, but unfortunately, because of time constraints, I won't be able to get into those. But what I can tell you about the findings is that we found more than we anticipated in the evidence base. And we also found gaps in indicators which are sensitive to the global south. And we also found gaps in indicators which assess development impact. And I also found it quite interesting that none of the measures that we found in the evidence base actually assessed how politics influences the quality of the process of EIDM. I mean, pointing to the presentations yesterday and how there was an emphasis on how politics actually affects the process of decision-making in most government spaces. So this is how we displayed the 37 measures that we found in the evidence base on Prezi. And I'll just like a few seconds as I move over to Prezi so I can show you how we displayed the measures that we found. So Ian, can you please confirm if you can see my screen?
Not yet. Oh, it's coming. It's coming.
Okay.
There we go.
Okay, thank you. So this is how PRESI looks like. We have an overview of all the measures that we found in the evidence base. So all of the 37 measures that we found in the evidence base are here. So you can actually zoom into the many measures that we found in the evidence base. So for an example, if I were to zoom into SAGE, for an example, you would realize that SAGE has 3 themes, which are further divided into 13 sub-themes. So if you maybe want to understand how they measured appraising the relevance of the research, you could click on that and you'd see that they considered measuring if the relevance was appraised by experts, the relevance was appraised using a structured and systematic guide, and etc. In the same way, maybe if I were to zoom into Repopa indicators, you'd realize that they have 4 measure themes which they measure around documentation, human resources, monitoring, evaluation, and communication and participation. So if you wanted to understand what points they measure under human resource, you'd click on that and you'd see what they measure under human resource. That is all I have for you today. Thank you so much for listening.
So, well, Andile, you went well under time, so congratulations on that. I must say that PRESI looks very impressive.
Thank you.
So congratulations. I think we've lost Kwaku, have we?
Yeah.
He seems to have gone. Okay, so now it's time to open it up to the audience. And there's a question for, I see there's a question for you there, Archie, about how does this influence what evaluators do, etc. Can you see the question?
I see it now. How does this influence what evaluators do, and how knowledge brokers, MA units, should work with evaluators, particularly in a complex field of like the environment sector? That's actually a very good question, Promise. How should evaluators then work with M&E, and M&E should work with evaluators? I think one of the things that we find useful, at least I find useful in my own work, and this is obviously based on personal experience, is to keep a sense of independence from M&E for the evaluator to not be involved in the policy decision or the policy outcome of the subject that we are evaluating. So that removes us a little bit from the outcomes of the decision. In practice, what that means is that suppose I make a recommendation in an evaluation, I'm not then involved or have no benefit to be had from the outcome or from the decision that's taken by the managers, which leaves me then to do future evaluations of that object, and then and B also I can make the recommendation, but I can't. On the basis of evidence, but recognizing that this is only one of the pieces on the basis of which the knowledge brokers and the decision makers have to make their decisions. That's actually quite important to remember, at least in my perspective, that humility for evaluators, that evidence is only one of the pieces that sits on the table. There are many other pieces that are involved in decision making, which include human priorities, which include other value systems, and sometimes equity, as it should be, and other principles that are not necessarily all taken into account in evaluations themselves.
I mean, Archie, you're this interim evaluation advisor in GCF. So does that mean you are commissioning evaluations rather than doing them?
No, Ian, actually we do the evaluations. The evaluations are approved in the work plan of the unit by the board, and commissioned by the board. Essentially, we do the evaluations ourselves.
And are you having to play a knowledge broker role as well as just doing the evaluation, actually doing some brokering role to make it interested, the policymakers interested, or the board interested, or indeed stakeholders of the GCF interested? And if so, how are you dealing with that from the value side? Not just as the evaluator, but as the knowledge broker.
Interestingly, here we play both those roles, where the evaluation unit, because it's independent from the management and the secretariat, does get to participate in the knowledge brokering, and we do get to create a sense of create an institutional space for evaluations really and evidence. I'm sorry. Just the right time for a phone to go off. What that means is that we get to interact with the board and provide them with evidence and provide them. And we've done that in a number of ways. In a new institution, we've been able to create the impression that evaluations are indeed credible, that evaluations indeed support the board in making its decisions by providing them information that they need. For instance, the rate at which this institution, or the effectiveness and efficiency of this institution. In terms of values where we draw them from, it's very important for us then to remember the mandate of the institution, which is not always easy. It's not always as easy as one would think, because the mandate was given to the institution about 7 or 10 years ago. And it's very easy to forget that as a compass. And I think of the evaluator's role as really, if you're flying a ship, it's really the compass that helps you set the direction. Or, if you think of all of us as a group taking a journey into a mountainous area, evaluators are the guards that have climbed up into the tree and looking over the horizon and telling you where to go. And we can do that only if we know where the leader of the group wants to go, and that's the value system, and that mandate is very important to remember for us.
Great. Kwaku, there's a question for you in the chat. I don't know if you've seen it, about how to enhance systematic review capacity outside of the health sector. Have you seen the question? Maybe Kwaku's just come. Yeah, okay. Can you see the question?
Hello, Prof. There's a question on the floor. Can I respond to it? Laurenz asked a question.
Yeah, please.
Can I respond?
Yes.
Thank you very much. Laurenz, I'm very grateful for that question. To be honest with you, my experiences with colleagues in agriculture got me thinking about how evidence-based research could be employed in other areas aside the health sector or health sciences. Honestly, this is a strategy that I think we can use to make a headway. First, virtually every thesis project work has something to do with literature review. Most of the times, you take literature reviews and you realize that it is just copy and paste. And I think that if we can start encourage, first let's build capacity and try to encourage supervisors to help their students do systematic reviews, meta-analysis of literature review instead of the copy-paste scheme. During my PhD time, that is what we did. My PhD thesis plagiarism check score was less than 3%. So, and as we speak, the plagiarism check of my PhD thesis has moved from less than 3% to about 60%. How did we do this? We employed systematic review, meta-analysis. So the literature review of my thesis was original work from myself and our lab group. I also think that if we encourage supervisors or students to resort to using literature review, systematic review, meta-analysis for their literature review, it will also lead to innovative research. Some of the researches you find in thesis are replication. The difference might just be just a country. Oh, it was done in Ghana, the other one in South Africa. But you look at the data and there is no innovation at all. You will agree with me that it takes a lot of innovation to do systematic review and meta-analysis. So I think if we look at it from this perspective, for sure, systematic review meta-analysis will cut across board Thank you very much. Now, on the issue of building capacity in systematic review, and also whether there's a link between building capacity in systematic review and you did mention, what is the other thing?
No, just
yes, it is here. Building capacity in systematic review and independently or in combination with rapid capacity for rapid reviews. From what I said, the two must go hand in hand. We will need to build capacity. When the numbers are more, we can be sure that we are likely to, and we assume that everybody productivity is the same. Determination to produce is about the same. We have numbers, we can be sure that we will have much more rapid reviews. That's how I say it. So I think it goes hand in hand. If we hold all other things constant or equally, and we have numbers, that will go a long way to improve upon rapid reviews.
Thank you, Kwaku.
Yeah, thank you.
So Andile, there's a question from Tanya saying, how do you think the organizations might use your work, and how might it influence the knowledge brokering work of ACE? You've got a lot of indicators there, so how are you going to use that? How's it going to make a difference?
Yeah, thank you so much, Tanya, for that question. And I mean, I posed the same question to policymakers because we try to be very user-centered in our approach. So we are asking policymakers how they think they could use the indicators that we have, because we have, like you said, we have a lot of indicators, but which ones actually work for the type of work that you do, right? So we can tailor the indicators that you need for your work. And also it poses a question to us as well to say, in the work that we do, how do we measure the impact? Because we have standards that we use to measure the quality of the evidence that we use, but not really a measure to assess the quality of evidence use. So I think it's quite interesting work, and we look forward to hearing what policymakers think they can use the work that we've done. And linking to the relationship talk there was a theme of yesterday. We have consulted a few of the policymakers that we work with, and we are in the process of trying to continue that process of trying to engage with them to see how we can actually use these very many indicators and measures that we found. Thank you.
Thanks, Andile. Archie, there's a question from Carlos from FAO. What do the panelists recommend for enhancing involvement by those often left behind? Do you want to respond from the evaluation side? And for example, in the GCF, how are you trying to make sure those people get their views in relation to climate change, etc., get considered?
Absolutely, Carlos, thank you so much for that question. I think one of the ways we do that, it's not the only way, but one of the ways to do that would be for the concerns to be accurately and adequately reflected in the normative framework that we establish at the beginning of an evaluation. And this normative framework then provides us a standard against which we evaluate the policy or the project that we should evaluate, right? So what are the concerns of the beneficiaries and the local communities or the vulnerable populations, and against that metric do we assess the performance of the institution? And that right away gives us a standard, gives a very clear direction as to how to evaluate the performance of this initiative, broadly speaking.
Thanks. And there's a question from Hersha. How do we assess the contribution to public value for countries on the African continent? I don't know, Kwaku or Andile, whether you'd like to respond to that.
Hello.
Can
I address Hashal Dayal's question?
Yeah.
Hashal Dayal. Yes. Assessing output in systematic reviews is a very, very important tool to measure its impact in society or a community or a country. No, here I will focus attention on health research, evidence synthesis in health research. To be honest with you, there are a host of technicalities in the presentation or what we publish out there. Firstly, especially in Africa, what we may have to resort to is, one, aside publishing our research in journal, we should consider making layman presentations of our work to the general public. With that, we can be sure that politicians who might not be scientists, any other person in the streets out there can read and begin to ask questions. But what at all is systematic review? How is it helping us? For instance, in Ghana, you go to the health sector, virtually most of the health professionals have little or no knowledge of meta-analysis. But personally, what I do is that I try to help some health professionals. The very last one was a medical doctor who was sending a patient to India for cancer treatment. When they got there, options to choose from as far as treatment method is concerned was a problem. So I told him, don't worry, I will get online and try to do some evidence synthesis, see how best I can recommend a treatment that will suit your patient. You see? So we will do this, and of course, practically it will help. Once it helps, we can always go back, do a follow-up to find out how our output is making impact in the health sector and also for the general public. It's not only health sector, even in agriculture. I'm yet to see evidence synthesis in agriculture in our part of the world, but we need it badly to come out with, to help productivity, etc. Thank you.
Okay, so we've reached the end of our session. I mean, I think we've touched on issues of supply and getting good quality supply. We've touched on issues that values matter and they influence what we do with the evidence. And we've touched on issues of, well, how do we measure impact and what indicators do we use? And I'd like to just finish by Archie's last slide, which is COP26 is coming up. The planet is burning. And what are we doing to make a difference about the planet? And also about the huge equity problems which face us, and to not get too hung up on the evidence, but also think about the action that's needed to make change happen. So with that, thanks everybody. Enjoy the rest of the conference, and we'll see you in some other sessions on another day. Bye everybody. Thank you.
Thank you, and thank you everyone.
Bye. Bye, Archie. Bye.
Hi, Kwaku.
Yeah, nice meeting you.
Nice to meet you too as well.